I am Dr. V.K. Agarwal, MD Medicine from Agra. Today talk is on the hypertension. Hypertension is a rise in the blood pressure. Now the new guidelines regarding the hypertension, as the WHO says, 63% death due to the non-communicable diseases. Out of that, 27% diseases are due to the cardiovascular diseases, and 45% people are between the age of the 40 to 69 of age group. The rise in the blood pressure, most important risk factor for the cardiovascular disease. The uncontrolled blood pressure is due to the low awareness and the lack of primary care and lack of proper follow-up. In India, the prevalence of hypertension in last 30 years has risen from 29% to 38% in male, and in female from 28% to 32%. 51% male or in 41% female, they are underdose of the hypertension. 62% male and 53% female, they are not getting the proper treatment. Out of 5, only 1 male and out of 4, 1 female worldwide getting the treatment of hypertension and getting the blood pressure controlled. This is the data worldwide by WHO, and it was published in the Lancet 2021. International Society of Hypertension Guidelines 2020 that says there are 2 types of treatment: optimal treatment and essential treatment. Optimal treatment is evidence-based standard of care. Essential treatment, minimal standard of care to allow the specification of essential standards of care. Next is the American Association of Heart and the American Cardiological Society 2021 guidelines. They says the stage 1 blood pressure is between the blood pressure 130 to 139 when the systolic blood pressure, and the 80 to 89 millimeter mercury is diastolic blood pressure. If it is associated with the ASCVD, atherosclerotic cardiovascular disease, or having the no ASCVD for last year, then no pharmacological treatment is needed for 3 to 6 months. Patient can be put on the lifestyle modification, reduction of the salt, reduction of the oily food intake, proper exercises. If patient doesn't get the result in 3 to 6 month period, then pharmacological treatment has to be started. According to the ACC guideline in 2021, when the acute respiratory distress syndrome was found, it was a fatal condition which was associated with the COVID-19. The treatment of metoprolol was beneficial in few cases. So metoprolol could be given in patients suffering from the ARDS. It decreases the lung inflammation, it increases the respiratory function. Next is the STEP trial and SPRINT trial. SPRINT trial was done in the older Chinese people, and the STEP trial was done in worldwide. They say that if you keep the blood pressure less than 110 to 80 millimeter of mercury, the risk of cardiovascular adverse events also gets reduced. The SPRINT trial has shown 26% reduction in the composite risk when the blood pressure was reduced. The importance of ambulatory blood pressure monitoring and nighttime blood pressure recording. Basically, it has got the prognostic value, but European Society of Hypertension 2018 that has guided the diagnosis not on the basis of the office blood pressure, but it should be on out of office measurements too. By ambulatory blood pressure monitoring or house or home blood pressure monitoring, 24 hourly, and night blood pressure monitoring. If the night blood pressure rises, the more risk of mortality and composite cardiovascular risk outcome are poor. For every rise of 20 millimeter systolic and 10 millimeter of mercury blood pressure at night, the risk of mortality increases by 23%, and the risk of cardiovascular events they increase by 36%. According to European Society of Hypertension, hypertension is lifetime problem and it requires the lifetime treatment. So the treatment should be started from the beginning in combination. The combination can be given as a ACE inhibitor or ARB plus calcium channel blocker or diuretics. Next caution should be taken when the valsartan was used. Valsartan now taken off or recalled because of the presence of the nitrous NDMA substituent. NDMA substituent is a nitrosodimethylamine which is found the carcinogenic to the liver, and this NDMA salt has been found in candesartan, irbesartan, valsartan, olmesartan, and losartan. The HYGEA chromotherapy trial, it was done for 6.3 years and 19,084 patients. The nighttime blood pressure was recorded and the treatment was given at the night time in comparison to the awakening time. The results were quite favorable. So the guidelines now to give the treatment of the blood pressure or control the hypertension, it should be preferably at the night time, not on the awakening time. Then we can get the better results and we can control the blood pressure in a very effective way, and we can improve the life of the patient and we can help the society in a better way. Thank you very much.